Hello, my presentation is on diabetes mHealth interventions. Diabetes is the fourth most common disability with over 385 worldwide. Diabetes accounts for the fifth highest cause of death worldwide. One way diabetes can be managed is through mobile health technology. This includes cell phone apps, automated phone calls, and text messages. So what are the benefits of mHealth applications for diabetes self-management? How effective are mHealth interventions in supporting diabetes treatment and self-management? What factors influence the use of mHealth applications for diabetes treatment and self-management? And what are recommendations for improving the design of mHealth applications for diabetes self-management? The benefits to mHealth interventions can be diabetes education, problem solving, self-efficacy, self-management, BMI improvement, better quality of life, and it's cost effective. The results have shown that in addition to the benefits, can increase diabetes knowledge, increase lifespan, there are 1% fewer amputations, a decrease in blood glucose levels, 63% reduction to admission to hospitals, and BMI improvement not only impacts patients' diabetes, but also lowers risk for many other health conditions. People are also more successful when families hold them accountable. Some influencing factors: only 50% of people with diabetes are willing to use diabetes mHealth solutions. People with low health literacy were less likely to answer their phone. People with depressive symptoms were less likely to adhere to medication and less likely to respond to text messages. And if participants are undisciplined, bored, or depressed, they often will not use the mHealth solution for a long period of time. Recommendations: well, one size does not fit all. There should be an app geared towards each demographic and culture for the best outcome. Customizable features would also be beneficial. They could be turned on or off. For example, participants in one study had mixed feelings about a reminder or an alarm feature on a diabetes app. Approximately 50% thought that they would want to have that feature, but at the time of the survey at the end, only a quarter of participants actually used the alarm. This information was not surprising to me. People could find it difficult to drop everything they're doing to check their blood glucose levels. It is not always seen as a helpful reminder, but instead annoying nagging. An alarm could also trigger a question from a coworker asking what the alarm is for, which would eliminate a sense of privacy. The most successful apps had only one feature. It's easier for an app builder to perfect one feature, and is easier for users when it's simple. So for a lot of app builders, keeping it simple would be one recommendation. For implications, the feature that kept coming up in my research was the need for diabetes education in mHealth. Doctors don't have a lot of time to spend with their patients, so an app could help bridge the gap in education and problem-solving techniques. A downside to mHealth focus on education is that eventually the user will reach the goal of learning the information and the feature will no longer be useful or needed. In addition, habits are hard to change. To go from eating whatever you want to being on a diet, monitoring blood glucose levels, exercising, and taking new medications requires dedication and a desire to improve your health. Seeing small changes and improvements can be discouraging or encouraging. An mHealth solution is merely a tool, not a miracle worker. Someone with diabetes has to put in a lot of time to manage their condition. Disadvantaged people are more likely to have diabetes, have a higher death rate, complications, difficulty managing their disease, and a lower health outcome overall. So there really needs to be a focus on creating diabetes mHealth solutions for disadvantaged people. In conclusion, there's quite a ways to go yet when it comes to mHealth solutions for diabetes. One surprise for me was learning that only half of patients reach their target treatment. It's remarkably difficult to manage diabetes. Often, different doctors will give very different advice. My mother used to work for the American Diabetes Association, and diabetes runs in my family, so the research was of particular interest to me. Also, taking Introduction to Health Informatics at FSU has been a great experience. I've enjoyed the read and reflect assignments, talking to fellow classmates about their own experiences, which at times are quite different from my own. I believe that we can all learn something from one another's experiences.